Hey everyone, I'm Jean. Thank you for coming to this recorded lecture. Today I'm going to be doing a quick training on bloodborne pathogens and sharps, specifically relating to how we're going to take blood pressure or blood sugars in the field. So let's get started. So at Valiant Foundation, we take blood sugars and we take it very seriously. Even though we take a lot of precautions, such as using safety needles, which is very, very hard to poke yourself with a used one, especially if you're not undoing the plastic and smashing it to get the needle out and poking yourself with it. Overall, you'll be pretty safe, but I want to talk about some special considerations, like how you need to wear gloves, proper PPE, make sure you don't come into contact with other body fluids like BSI, body substance isolation, HIPAA, and so on. So again, while we are not healthcare providers, we are still going to follow HIPAA, which basically says we want to be confidential and ethical when we handle participant information. So people who request our services, sorry, I got a phone call. So people who are requesting our services, they might be very vulnerable and concerned about where their information is going. So we want to remember um, to follow healthcare practices, even though we're not healthcare providers, because they hold good standards for how to work with vulnerable populations. So we will only share results to surveys or vital signs or any information about a participant with them themselves or your supervisor if you need to give it out. Never write down somebody's name in your reports. Never share health information with anybody. Keep discussions private. You should speak in a quiet voice, a few feet away from other people. Offer to move to a secluded location to take measurements or discuss results of your screeners. Don't share information about the participant with their volunteers. So an example of this might be if a participant's asked, so do I have diabetes? You would not say, yes, you definitely do. Instead, you'd say, we can't diagnose. This reading suggests it'd be a good idea to get seen at a clinic for further testing. So again, we can't diagnose, we can't treat. We are screening people for common health problems and then providing referrals. So no diagnosis, no treatment, screening, referrals, and education. Um,
Yeah. Well, they say.
So scope of practice, we are not healthcare providers. We offer screening, so basic health checks such as checking your blood sugar, heart rate, oxygen, sharing plain language health information and handouts or self-care tips, and directing patients to free or low-cost clinics, urgent cares, or emergency services when needed. So what we can do is we can use glucometers, BP cuffs, pulse oximeters. We can record results under ID codes without names. We can explain the results in plain language without saying like a diagnosis or technical terms, just plain language. You can provide pamphlets, resources, referral lists, encourage participants to seek care if readings are abnormal, and you can call 911 in the event of an emergency. And if the person is undergoing a true medical emergency, you are protected under the Good Samaritan law and you're allowed to act. For example, you can initiate CPR. If somebody is like broke their leg, maybe you could tell them, hey, don't move, stay here, and you can keep them in one position so that way they know, like, so they don't continue to break it further. Just what a reasonable person would do. As a volunteer, you are no different than the average person on the street. You don't have any extra training. You're just acting as a reasonable person. Like it would be reasonable for somebody to give out a pamphlet on health clinics in the area or explain a result is outside of the normal range and how you can get that checked out by a provider. So, but bloodborne pathogens and sharp training, we use safety lancets. These are very hard to prick yourself with unless you break this plastic right here and like you have to step on it or smash it in some way to take the lancet out and poke yourself with it. It's kind of unreasonable to do that. So basically you just twist off the top, press it into somebody's skin after you clean it thoroughly and you're wearing gloves, wipe off the first drop of blood, and then take the reading. Blood can carry hepatitis B and C. That's going to be a quiz question, and HIV. So we are going to use clinic level precautions, even though we are not healthcare providers, to protect clients and volunteers. So ask permission, share results privately, no photos or names in public places, hand hygiene before gloves and after removing them, new gloves for each client. You absolutely have to change your gloves every single time you work with a different participant. That's very important. You have to clean with an alcohol prep pad. Make sure to clean the area around you, no food or drinks in the testing area. You press the lancet into their skin after you pull off the purple tab on the back end of the lancet. We only use single-use auto-injecting safety lancets for all checks. You will never ever use a lancet that could ever be reused. That's just not something that we do. If someone asks you to do that, that's wrong. Ignore them. You absolutely have to use our single-use ones and then discard it afterwards. We do not recap needles. We will never ever use something that could even possibly be used twice. They're always going to be single-use auto-retracting safety lancets because, again, the only way to prick yourself with one of those is to take it apart, pull the needle out, and poke yourself. So that's why we use it. We are not going to put ourselves at risk by using something that you could prick somebody more than once with. Yeah, never handle a client's personal syringes or needles. Offer a sharps container and education instead per our policy. So this is an example of a sharps container. This is different than a biohazard bag. A biohazard bag is something that it's just like a plastic bag that's red and has the word biohazard on it, but we need to put lancets in a rigid container because they contain a needle. Yeah, keep this close, always locked. So if you get stuck by a needle stick or blood splashback, wash and flush the area with, for a skin and puncture wound, use soap and water. Don't squeeze hard, no bleach. Eyes, nose, mouth, flush and clean with water. Eyes for 15 minutes and remove contacts. Report and document. So tell your lead, record time, what happened, device type, part, and other important information in a text to Jeannie. I'm the research director, so I'm responsible for the project. If you are doing this as part of a project, and this is my phone number, this is to complete a exposure form. So that's very important. And then you need to get medical intervention ASAP. So you can go to the SFSU, for SFSU students only, you can go to the Student Health Center and describe the situation. If you're a non-student SFSU student, go to the closest emergency room and describe your situation. And by agreeing to Valiant Foundation's by agreeing to being a volunteer at Valiant Foundation, you acknowledge that while proper safety precautions will be followed, there is always a small risk of exposure to bloodborne pathogens. You agree to hold harmless the Valiant Foundation and its affiliates, including me, the Valiant family, from any legal liability for such exposures, and you accept responsibility, including financial responsibility, for seeking coverage of any medical treatment that may be required. Again, it's very unlikely that you'll have to do that because you're getting a drop of blood from somebody, and in order to poke yourself with a lancet, you'd have to manually take apart the entire the plastic. You'll have to smash it to get the needle out, and you'd never really have to deal with more than a drop of blood. If you do that, you're doing something way out of the scope of this document here. Okay. And then now I'm going to talk a little bit about diabetes. Well, yeah, again, absolutely avoid reusing sharps, recapping, overfilling the sharps container, or posting identifiable results or photos. So I want to talk a little bit about diabetes. This is very important for our, well, actually, we'll talk about this later. But just know, for blood sugars, they should be between 80 and 120. If they are very, very high, or if the glucometer reads the word high, then that person might be sick. If it's well above 120, that person 200, 300, 400 high, you might recommend that person goes and gets seen by in a clinic. or an emergency room if they're symptomatic. And if it's very low, like 70 or lower, then again, recommend an emergency room if they're symptomatic or even without symptoms. Um, much time do I have? Oh, actually, I think we have enough time to go over this really quick. Um, so there's two types of diabetes, type 1 and type 2. Diabetes is a condition where the body cannot properly regulate their blood sugar. Glucose is the body's main source of energy, and insulin is the hormone that helps glucose move from the blood into the cells. In diabetes, this process is disrupted, leading to high or low blood sugar. So type 1 diabetes is um, it's caused by like an autoimmune condition. So your immune system is going to attack the pancreas and kill the beta cells, and those are the ones that produce insulin. So signs and symptoms of acute type 1 diabetes is excessive thirst and urination, blurred vision. It's very sudden, has a very sudden onset, usually in children or young adults. I feel fatigued. Um, this is less common, but if someone says they have type 1 diabetes, some questions that you might want to bring up is, do you have access to your insulin? Because type 1 diabetics always need to take their insulin in order to survive. If a type 1 diabetic doesn't take their insulin for one day, they can die. If they don't take it for 3, 4, 5 days, there's a very good chance that they're going to die. So be very sure to ask, are you type 1 or type 2? If they're type 1, go down the route of, are you able to get your insulin? If you'd like to look into this further, you can talk about insulin pumps, CGMs, like continuous glucose monitors. If they have their own glucometer to check their blood sugar, do they get their A1C checked? But I'd like you guys to look into that further, and we will talk about that more in other classes. Then type 2 diabetes, this is much more common. It makes up over 90% of the diabetes cases in the US. And in this, the body is still producing insulin, but the cells don't respond to it because they become very resistant. Sometimes it's because genetics, other times it's always a combination between genetics and environmental factors. So you might be genetically predisposed to it, but people who are much heavier set have very high sugar diets, especially sugary drinks. New meta-analysis was talking about sugary drinks are one of the big drivers of type 2 diabetes. Um, just so much sugar desensitizes the cells to insulin, so it's hard to let it in. And again, like here's some issues. Slow wound healing I want to bring up. People who have type 2 diabetes might have a lot of foot ulcers. That's a common problem you see in the homeless population. Numb or tingling in the hands or feet. Develops gradually. Fatigue, thirst, urination. It can be managed. Sometimes it can be managed with lifestyle changes and pills. Pills include metformin. If you hear somebody say that they take metformin, that's usually for diabetes. And if they have type 2 diabetes, you might say, are you able to get your medications? Or maybe you could ask, like, do you have like a place to refill them? And sometimes they eventually need insulin too, but it's not as common as type 1 diabetes. Yeah. So insulin pumps can cost thousands of dollars and they need to be charged every day. These are for type 1 diabetes. This will give you a dose of insulin. And then continuous glucose monitors need to be changed every 2 weeks, and these cost around $100 a month with health insurance. And if they don't have health insurance, it'll be much, much more. They need to get their A1C, which is an average blood sugar of 3 months, checked because higher A1Cs correlate with higher mortality rates. You want an A1C of below 7 if you have diabetes. You want to have regular visits with a primary care provider or endocrinologist. So yeah, they often face limited access to insulin, glucometers, test strips, difficulty storing insulin because it needs to be refrigerated, poor wound healing, higher risk of foot ulcers and infection, higher rates of hospitalization for uncontrolled BGLs, missed follow-up appointments due to unstable housing or transportation. Yeah. And then really quick on how to use a glucometer. Your first step is to put on gloves. Your second step is to insert a test strip into the glucometer, as you can see in the photo. Your third step is to clean the finger with alcohol and let it dry. Lance the finger, wipe the first drop, and use the second drop on the strip. Dispose of the lancet in a sharps container and apply a Band-Aid to their finger. Remove the gloves and perform hand hygiene. Okay, so if you guys have any questions, you can actually text me personally. Otherwise, I am going to end that here. Thank you.
Good.